my name is Stephen Kidd. I'm like Steph, I'm an HSST. I'm in my 4th year, so 18 months to go. It's been a pretty intense time, but one thing that has made things go more smoothly is working with really great colleagues, collaborators from all over the country. So I'm going to have a slightly different take on Steph. I'm going to kind of talk a little bit about kind of the evidence around the importance of professional networking, collaborating, give a few hints and tips, and then maybe just a couple of examples, if that's okay. And I put my email on the front page, so please feel free to email me if you need to. So I have a background of clinical research prior to becoming a clinical scientist at what was the Health Protection Agency and then Public Health England, and came into the NHS in the last 10 years. And one thing I did note, and something that you've all experienced, is the huge amount of silos that are present in public health in the NHS. And I always made it my business to try and disrupt these silos because I always felt they weren't very helpful. So I'll kind of talk a bit about this. So just one thing before I note is I put as a bit of a joke is, do not stick your head above the parapet. We're all clinical scientists. We're all on a journey to become consult clinical scientists. And one thing we all probably all have in common is we do stick our heads above the parapet when we feel that something needs to be done better, or we think we can improve something, or actually I don't like that idea, and so we often get shot at, and it's something that I always wonder why I bother, but then in the end it's who I am and it's why I'm a clinical scientist. So okay, so let's go back in time. Why do we bother? Why don't we just do what we want in our own time as individuals and just try and become the best as we can? Well, actually, it all goes back to the Enlightenment in 17th century, with the likes of Sir Isaac Newton and John Locke, and the creation of kind of scientific inquiry done the right way. And Sir Isaac Newton kicked off the Enlightenment. He's kind of one of the main figures when he published Mathematical Principles of Natural Philosophy. Okay, and this then kicked in to the creation of everything that we enjoy today, that is professional networks, scientific connections, scientific societies. So everything started in the Enlightenment in the 17th century. So the creation of peer-reviewed journals, the creation of scientific and medical societies, the public health initiatives, and something that is really important. So Immanuel Kant did a lot of work on the work led to the creation of medical ethics and patient rights. So which then created this whole school of evidence-based medicine, and that's what we do. We create evidence to best inform patient care, whether it be through our clinical research, whether it be through our day-to-day improvements of service. It's all around moving away from kind of anecdotal evidence to proper, robust data that drives our healthcare and improving patient outcomes. So a little bit of an overview, everyone does it differently. It's not a new concept, but as Steph mentioned, sometimes networking sounds a bit of a dirty word, and I've had a few eye rolls when I've had colleagues in our laboratories and they're saying, what are you up to this? Well, I'm going to a conference in network, and they just don't quite get it and understand sometimes. So it's probably something that we are guilty of, is not always explaining why we do it, the importance of doing it to our colleagues who maybe don't live that journey in their careers. But I think definition of networking is, you're building and nurturing professional relationships at all levels, and don't feel you have to be senior before you start doing this. Do it from day one, and this will open up many avenues, which I will go through. But if I just take a step back, as clinical scientists, most of us, we're innovators. We're a phenotype of people who enjoy pushing the boundaries, being disruptors, and we are trained or being taught to be leaders in our field, and that does come with its pitfalls and challenges. But I think I put together the 5 kind of really good ingredients to being a clinical scientist that will enrich networking and creation of these peer networks, essentially, is looking for people like us. And, because we are generally creative and compelling communication is key. We are committed to lifelong learning. We're not going to just finish our training and that's it, and we rely on our laurels for the rest of our careers. We're always going to be learning to new things. With team players, we enjoy working together. We enjoy working on our own, but essentially we're our team players, and we like to build good teams around us. But I think more than anything, as Steph has mentioned, you'll be courageous and resilient. It's not easy putting yourself out there. It's not easy trying to go chat to new companies or other luminaries in the field that you might be nervous to talk to. So it does take a certain amount of courage and resilience, and it doesn't always go right. So we need to remember that. So I don't know if everyone's aware of this, but the law of diffusion of innovation. And now the reason I put this here is because it's just a bit of evidence of why we have to network, because we are on the left-hand side here. We are the innovators and the early adopters, generally speaking. Okay, there's not many of us, so we all need to link up. And the best way to link up is to go looking outward for people who are like us, because we need that higher concentration of innovators and early adopters to be able to drive clinical science, to drive innovation in the NHS, etc. So this is the reason, because we are very much on the left-hand side there, and there's not many of us, so we need to go and hunt for each other. Okay, so we've established the importance of it. We've established the fact that there aren't a huge high concentration of us. We've got to go looking. So this helps to break down those silos. Can we go and find each other, and kind of multidisciplinary networks working together are really powerful, and there's good evidence that better patient outcomes are linked to multidisciplinary team efforts, whether it's within your own hospital, your region, or nationally. We all love to do research, so creating collaborative opportunities is perfect for that. Multi-site, multi-center studies are always far more powerful than single sites. Access to different demographics of patients, which then can lead to high quality projects and peer review publications, which enriches the evidence base for what we do. And just essential career advancement opportunities, linking to really good mentors. You all should have a good mentor, somebody inside your trust and somebody outside your trust, because it's really key to growth. And the only way you can find them is by going and looking out. So I like this quote from Michael Plummer. It was published in Forbes. Instead of focusing on problems, disruptors brainstorm solutions. Their ideas are likely unconventional. The ones that work often set precedents. And the only way that we can get these ideas to gain traction is if we have and seek out more of us. Because I don't know about you guys, but when I've sometimes come up with a bit crazy ideas, it takes a while for them to settle. But if you've got backing from your peer-to-peer network or your collaborators, then these things can often sit better. So you got to keep growing your network. Don't rest on your laurels. You want to keep on growing these as much as possible. Think of it as a living beast. Okay, as Steph said, attending conferences and workshops, get yourself out there. I, like Steph, like doing things in person. Doesn't mean that that's the only way. I find that it's quite good to engage face to face. Always do it over a coffee. I find really works well. Joining professional associations are really good. So I'm a microbiologist, so I'm in infection, so I'm ensure that I'm associated and affiliated with a number of medical societies and infection-based societies, just so I can access their resources, their peer-reviewed journals, grants, applications, and other people who are a lot cleverer than me. I can learn off them. And then I think someone mentioned LinkedIn. LinkedIn, I think, is excellent. If there was only ever one social media platform and the rest were all done away with, which I'll be a massive fan of, I think LinkedIn would be the one that would still live, because it's very, very good for building those networks. And growing and nurturing, like I said, treat it like a beast. It's got to grow and you got to nurture it. So regular communication, be someone who is easy to get hold of. Don't be afraid, keep on, stick to your words. If you agree to do something, do it. be someone who can be reliable, share your achievements and updates. You're doing this to grow team and grow your specialties, not for individual glory. I think it's really important to mention that you're not here to build your own empire. You're here to grow and bring people up with you, and stay engaged, and do things like we're doing now. Hopefully try and share some ideas for people coming through. Trial and error, as you can imagine, the scientific process, scientific inquiry, it's not always going to work first time. And I kind of bring this to a close. This is a really nice. I'm a big fan of Simon Sinek, and he's got some really inspirational talks. But I think this kind of really sums it up. Offer your strengths to others, and you'll be amazed how many people offer their strengths to you. And I think that's really key, and I've really found that. So I'll just give an example before we finish. Is collaborative efforts during the recent pandemic, were extraordinary. But one thing I found was actually breaking down even the silos within our own National Health Service. And so we reached out and worked with people in veterinary science, epidemiologists, the people who wouldn't necessarily be our first port of call, and it enriched our evidence base, it enriched our different perspective, thinking outside the box. And as a result, we've now built lifelong networks and really interesting ways of thinking. And don't always look within the academic or the scientific, reach out to companies as well, because it's really important to work with companies within medtech, within assay design, because remember, we want to shape what they offer us in the future in terms of improving medical healthcare. So I don't always think that working with industry is a dirty thing. I think it's also really important. But I think that's about it. I probably rambled along, put a lot into that, so I hope that makes sense.